Hi, I'm Susan Taylor at Scripps Health in San Diego, California. Every year in the U.S., roughly 800,000 people suffer a stroke. That is one person every 40 seconds. According to the CDC, the Centers for Disease Control and Prevention, strokes kill about 140,000 people each year. That is one person every 4 minutes in the U.S. And if you are showing symptoms of a stroke, it is critical to your survival to get to the ER immediately. Scripps is San Diego's leader in the treatment and rehabilitation of patients who suffer a stroke. Joining us is Dr. Mary Califoot. She is a neurologist with Scripps Clinic in La Jolla, California, and she is the medical director of the stroke program at Scripps. Thanks so much for being with us, doctor. Let's start with the basics. What is a stroke? What causes it?
So a stroke is a lack of blood flow to the brain, just like a heart attack is a lack of blood flow to the heart. This causes neurologic problems with people being able to function.
And what causes it?
So it's a lack of blood flow, so that can be due to embolism or a clot going from the heart to the brain, or it can be caused by a small blood vessel being closed off inside the brain.
And what are the symptoms of a stroke?
A stroke usually causes weakness on one side of the body, or it can cause numbness on one side of the body. It can also cause difficulty speaking or comprehension of speech.
And do all of these come in a cluster?
So the hallmark of a stroke is that it happens acutely. It's not something that gradually comes on, but comes on all at once. And the symptoms start maximum at its onset, and with time improves.
So if you have difficulty speaking, if you have numbness in the arm, if you're weak, you can't walk, it all just kind of acutely happens at the same time.
Exactly right.
Okay. Are there different types of strokes?
So there are two major types of strokes. One is called ischemic, and that means a lack of blood flow. And the other type is hemorrhagic, meaning there's blood in the brain.
And is one more serious?
It really depends on the size of the stroke and what areas of the brain are affected. So sometimes people can have a small ischemic stroke that is relatively mild, or they can have a large ischemic stroke that can be very devastating. Same thing with the hemorrhagic stroke. If it's small, it might not cause major symptoms, but if it's large, it can cause some significant deficits.
So what is a transient ischemic attack?
A transient ischemic attack is for a short period of time, there's a lack of blood flow to the brain. And luckily, that blood flow gets restored, and so there's no actual damage to the brain. The thing about a transient ischemic attack is it's a warning sign that you possibly could have a stroke. So it's important to get to your doctor and make sure that your risk factors are under control.
So that you would go to, what, your primary care physician, or you go to a neurologist, or you go right to the urgent care or the ER?
So if you have signs of a stroke, you should immediately call 911 and go to your nearest emergency room.
But I'm talking about the transient ischemic attack. You say it's kind of the precursor to the
Yes.
stroke.
So if you need to get medical attention right away, I would not put that off for weeks and weeks. If you can get in to see your doctor that same day, that would be fine. If you can't, then you really need to be evaluated in the emergency department to make sure that there's nothing that can be treated right away to prevent a stroke.
And what's a cryptogenic stroke?
A cryptogenic stroke is just a fancy word for we don't know exactly what caused the stroke. So when we evaluate a patient for a stroke, we look at the heart to see how the heart's functioning. We also look at the blood vessels that feed the brain. We also look at the blood to see if there's any reason why somebody would have suffered a stroke. We also do more intensive looks at people's hearts to see, is the heart beating normally? Do you have an irregular heartbeat? And that can take actually months to figure out. So in a patient who's had a stroke and you do the usual workup, trying to figure out why they've had the stroke, sometimes we need to go a little bit further and do more intensive investigations. One of the exciting technologies that we have is a cardiac monitor, and this is what it looks like. This is a heart monitor. You can see it's very small, and what the cardiologists do is that they put it right underneath the skin. And what happens is
Where does it go?
So it goes right about here.
Right about there. Mm-hmm.
It's very well tolerated. It's just put right underneath the skin. It doesn't require major surgery or touching the heart in any way. It's right under the skin. And what happens is that it's constantly picking up your heartbeat all the time. And when you go to bed at night time, there's a bedside monitor that the information is downloaded every single night. and then it's sent up to a satellite, and then from the satellite it's sent down to the cardiologist who looks at it on a daily basis to see, is there any irregular heartbeat? Because if there's an irregular heartbeat, that can cause a little clot to form in the heart and go from the heart to the brain. The reason we have to do these monitors is because this is something that comes and goes. It's a rhythm, an irregular rhythm called atrial fibrillation. In a lot of patients, this is not there all the time, but it comes and goes, and it's difficult to catch. Because as you can imagine, if you go into your doctor's office and have an EKG done, you might not pick it up.
But the cryptogenic stroke is a stroke that happens and you're really not sure why. Does that happen? What's the age group for someone who would suffer a cryptogenic stroke?
This can happen at any age. Of course, as we age, strokes are more common, but a cryptogenic stroke can happen at any age.
So this is a very well choreographed dance between the neurologists and the cardiologists.
Yes, absolutely. We work very closely in this situation. When we have a patient, we frequently send them to cardiology to have this device implanted. There's something called a patent foraminal valley, or we call it PFO, which is a small hole in the heart that's relatively common. But we do see that there is an increased risk of stroke in young patients that have this. So if we do find this, and we do feel it is the cause of the stroke, then the cardiologist can go in and close that hole and prevent stroke.
And why is time so very critical in diagnosing a stroke?
Time is very critical in diagnosing a stroke because we have treatments to restore the blood flow. There are two major types of treatments that we have. One is a clot-busting medication, something called TPA, and that medication can be given within the first 4.5 hours of a stroke. So that's why it's very important, if you have stroke-like symptoms, to call 911 and get to your nearest emergency room. There are other types of treatments when patients have what we call large vessel occlusions, meaning one of the larger blood vessels in the brain is closed off. What doctors can do at that point is take a catheter, which is a little tube, and insert it in one of the blood vessels in the leg and have it go to the blood vessel in the brain that's closed off. They grab the clot and pull it outside the body, and then blood flow is restored, and hopefully there's no damage to the brain.
We want you to hold this thought. We're going to come back to it in a couple of minutes because time is so critical. Recognizing the signs and symptoms of a stroke and taking quick action can be remembered by the acronym FAST. And so we're going to tell you what that FAST stands for. Should you call 911 and have the ambulance come? Or should you drive yourself to the hospital? Because a lot of people will say, I'm okay, and maybe I'll just get myself to urgent care of the hospital.
Yeah, so I hear that frequently from my patients. I think it's very important to call 911 because sometimes, even though your symptoms may resolve, they can actually come back while you're driving or while your loved one's driving. You don't want to put your family members or friends in that situation where you start to deteriorate. So it's best to call 911 and get to the hospital immediately.
And who's at risk for having a stroke?
So people that are at risk for having a stroke are those that have high blood pressure. Usually that's not well controlled. Diabetics are at increased risk. People that smoke are definitely at increased risk. Also, cholesterol can play a role in the development of a stroke.
And what tests are used to diagnose the stroke?
So when a patient comes in acutely, the first thing that we do is a CAT scan. And we look at the brain itself to see if there's been any bleeding in the brain or if there's been any changes in the brain. We also do something called a CT angiogram, which is done at the same time, and that outlines the blood vessels that feed the brain, both in the neck and in the brain.
So you talked briefly about treating the stroke. There are these, the minimally invasive procedures to treat the stroke, and you talked about the clot-busting medication within 4.5 hours of onset of symptoms. What are the other ways to treat it?
So as I was saying before, there's the embolectomy or thrombectomy.
Yeah. And what's the difference between those two?
So the difference between the TPA is a clot-busting medication. That is given by IV. Mm-hmm. You just have to start an IV, and it's infused over an hour. There's no catheter involved in this, but an embolectomy or a thrombectomy is a procedure in which we see that the patient has a very large stroke and one of the major blood vessels of the brain is closed off.
Right.
So then a doctor will take a catheter and take that up into the blood vessel that's closed off. We'll grab that clot and then take that clot out, and the blood flow will be restored. So those are the two treatments that we have for acute stroke.
And if you've had a stroke, what's the likelihood of you having a second stroke?
Well, stroke is a kind of a broad topic because it can be caused by many different things. It can be caused by cholesterol buildup in the blood vessels in the neck or the brain. It can be caused by an irregular heartbeat that causes a little clot to form. It can be caused by hypertension and changing of the very small blood vessels inside the brain. So every patient's a little bit different. So the most important thing to know about what your risk is to see your doctor and to have your risk factors evaluated, because every patient's a little bit different. And once you control your risk factors, then your risk for a second stroke certainly decreases.
All right, so we referenced this a couple of minutes ago, but let's come back to this now because time is so critical, recognizing the signs and taking quick action when you think that either you or somebody you know is having a stroke. And remember by this acronym FAST. So what does FAST stand for?
So F stands for face, which you ask if you're with someone you think may be having a stroke, you ask them to smile and you look at how their face moves. And of course your face should be symmetric and there should not be any weakness on one side. So if there is, that's concerning.
Like a drooping face.
A drooping face,
okay.
Exactly.
Right.
A is for arm, and so you ask the person to extend their arm like this. If they can't do it or one arm kind of drifts down, then you know that there's a problem. S is for speech, and you ask them to say a sentence, and if it's slurred or it doesn't come out correctly, then you know that there's a problem. And then T, of course, is for time, making sure that people understand that you have to get to your nearest emergency room if you have any of these types of symptoms.
Immediately.
Yes, immediately.
If you have a stroke, what's the treatment?
So there are two types of treatment. One, of course, is in the acute phase, which we've already talked about. But then for prevention, we first want to be sure that the blood is thinned. We want to prevent clots from happening, and there are different medications we can use for that depending on what the problem is. We also strongly recommend in most patients to be on a cholesterol medication, not only to lower the cholesterol, but we know in many different studies that independent of lowering the cholesterol, these medications do something else for stroke prevention, possibly work on inflammation or protect the nerve cells or the blood vessels. But we do know that even if your cholesterol is relatively well controlled, that being on a cholesterol medication can be helpful. Of course, making sure that your blood pressure is under control. If you have diabetes, making sure that's controlled. Making sure that you don't smoke, because that's a very strong risk factor. And then finally, not drinking to excess.
And what about the family history? If somebody in your family has had a stroke, does that make you more susceptible to one?
There may be some familial risk factors. That's not something that's well characterized, but it is something to look into.
And who makes up the stroke rehabilitation team?
Oh, that's a very large team, okay? And again, it depends on each individual patient what their deficit is. We do have the physical therapists that work on mobility problems. We have the occupational therapist, very important, who helps us with what we call activities of daily living. Just the normal things that we take for granted, like learning how to brush your teeth, how do you make a sandwich, very things that we do on a regular basis. Then we have the speech therapist, also extremely important if you have problems with language, problems with swallowing, cognitive problems, they can help with that.
And how long does it take to come back from a stroke? How long does it take to be rehabilitated?
Again, depends on the patient and the size of the stroke, but people can get better from a stroke for up to a year. So it's a long road.
It takes that long.
It can take that long. So it's a very long road, and again, depends on the severity of your stroke.
Are strokes largely preventable?
So looking at your risk factors, trying to control those, that can really help prevent a lot of strokes. Again, making sure that you're treating your high blood pressure if you have it, making sure that your blood sugars are under control, making sure that you don't drink to excess or smoke. Those are all very important risk factors.
And when you say drink to excess, what does that mean?
So one glass of alcohol or one wine or beer a day seems to be okay, but once we start drinking more than that on a regular basis, that can increase your risk.
Now, all Scripps hospitals equipped with an emergency room are designated as primary stroke centers, but Scripps Memorial Hospital in La Jolla is a comprehensive stroke center. Can you explain the difference?
So a primary stroke center has been certified that they can take care of patients who have an acute stroke. meaning that you come in within the first 4.5 hours of your stroke and you need to get that clot busting medication. All of those hospitals are well equipped to do that. They can get you in to get your CAT scan immediately, have the physicians available immediately to provide that care. So that's very important. The Comprehensive Stroke Center is one level higher than that as far as taking care of complex stroke patients. In the Comprehensive Stroke Center, that is where the embolectomy is performed. And if you have a significant need for long-term monitoring for your stroke or other types of procedures, you would be taken to the Comprehensive Center.
And now the American Heart Association and the American Stroke Association has designated Scripps hospitals with a Gold Plus status. What does that mean?
So the American Heart Association has many different awards, and this is the top award for the stroke hospitals. This demonstrates that there are certain metrics or certain measurements that we have to abide by in order to take care of our patients well. And to achieve that level, you have to take care of your patients meeting all these metrics, doing it in a quick fashion and in a safe fashion. So we have achieved that for all of our hospitals.
Any final thoughts?
Again, I think the important thing to keep in mind is time is brain, and that if you're...
That's a great line, time is brain.
Yeah. So if you are having symptoms consistent with a stroke, please get help immediately because we do have treatment for this.
And please do not drive yourself to the hospital.
Exactly.
Thank you so much, Dr. Calfoot. We appreciate it.
Oh, no, my pleasure.
The bottom line is if you think you or someone you know is having a stroke, please call 911. Do not wait. It may just save your life, and it may save the quality of your life. Want more information about strokes? Please click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.